name is Oluwamayowo Ogunjimi, a sleep clinician at the Lagos Executive Cardiovascular Center. Today, I will be talking about sleep health, and the myths associated with sleep disorders. Sleep is a recurrent state of the body and mind characterized by closed eyes, altered consciousness, inhibition of sensory responses, and inhibition of certain muscles in the body, especially the voluntary muscles. Sleep plays a vital role in the body's mechanism, as it is important for proper functioning on a day-to-day. Sleep plays an important role in removing stress placed on the body during the day and repair of worn-out tissues from the body. Also, proper sleep in the right quantity and quality is very important for memory consolidation, glucose reuptake and regulation, blood pressure regulation, as well as immune boosting of the body system. Sleep health is the quality and quantity of repose or bedtime an individual can attain, and its impact on the overall well-being of that individual. That said, as much as it is not well promoted in this part of the world, sleep health remains one of the 4 main pillars of health, as food is important to our body and water essential to our daily living. Sleep remains an essential factor to our very day existence. The importance of sleep resonates across every system of the body, from the cardiovascular system to the respiratory system. But it is sad that most people don't pay attention to their sleep health. Even so, they go ahead to prevent their children from getting the right amount of sleep they need, because most people, especially in Nigeria, believe that when you sleep too much, you are attracting poverty. This mindset has caused so many sleep disorders in people, as they are not getting the right quantity or quality of sleep their body deserves. Sleep plays a crucial role in ensuring that the immune system is strong, the cardiovascular system is strong, the proper growth of the body is moderate, and then hormonal secretion and reuptake is also in accordance. Regardless of how you feed, or how much exercise you do, or how much yoga you expose yourself to, if you do not get the right quantity of sleep your body deserves, it can lead to devastating effects on the overall health. How bad a sleep disorder is depends on the quantity and quality of sleep you are getting and the frequency with which that sleep distortion or that sleep disorder occurs. Usually, for the case of insomnia, people who experience inability to initiate or maintain sleep about 3 times every week for more than 3 months is regarded as very serious. That said, it is also important to know that there are more than 83 sleep disorders. So there are different things that can cause different types of sleep disorders and how bad it can get. Sleep disorders can be caused by a lot of things. Stress and anxiety, as in the case of insomnia, is one. Another is underlying medical conditions, as in the case of low back pain, fibromyalgia, and other forms of disorders such as heart conditions can cause sleep issues. Aside this, bulky neck, obesity, and deformed oral cavity can also cause sleep disorder, as in the case of obstructive sleep apnea or sleep-related breathing disorders. Other things that can cause sleep disorders include allergies, poor sleep, age, quality of sleep or sleep deprivation, as well as medication. Symptoms of sleep disorders vary depending on what that sleep disorder is. It might be inability to initiate sleep, inability to maintain sleep, inability to get refreshing sleep. It might be excessive daytime sleepiness. It might be inability to actually conjure or remember what you did during sleep. It can also be fatigued. It can also be loss of memory. It might also be grumpiness, behavioral derailment, depression, and many other signs psychologically affecting the person. To treat sleep disorder, the first thing you need to do is properly diagnose the condition, because there are different types of sleep disorders, right? So in order to treat sleep disorder, to diagnose it is the first step. In the diagnosis of sleep disorder, physical assessment, symptoms history, and other medical histories are taken, after which an overnight sleep study, also known as polysomnography, is also taken depending on the type of symptoms or the complaints the patient might have presented with. We have 3 stages or 3 levels of polysomnography: stage 1, stage 2, and stage 3 sleep polysomnography. Most of the time, especially at LECC, most patients come presenting cases of obstructive sleep apnea. In that case, the level 3 polysomnography is what we use in properly diagnosing and knowing the severity of the sleep apnea. We also use it in knowing which is much prominent among the 3 different types of sleep apneas that exist. If it is obstructive, if it is central, or if it is mixed. All these will help us and enable us to properly devise a treatment plan that will benefit the patient. In treating these conditions, we could probably use, depending on what the condition is, we can use medication, lifestyle changes, or the use of devices, as in the case of PAP therapy, positive airway pressure therapy, to treat certain sleep disorders.